Warm greetings to everyone. I am Ambika Purohit from 4th SEM. I am here to present the topic identification of special children and various assessment techniques for visually impaired child. To start the topic, let me first narrate you a story. So it is the first day of a school with a new academic session. All the students were enthusiastic and also the teacher is being aware of there are so many new admissions in the classroom. She was observing each and every student. While teaching in a classroom, teacher observed some of the different behavior shown by the four of the students. So these four students were showing different behaviors. One of them had eye turning in and out. Second one had excessive tears in her eyes. Third one had red eyes. And the fourth one had styes on his eyes. Next day, the symptoms reappeared among the same students. Now the teacher was concerned about the symptoms and she wanted to know the reason behind such kind of symptoms. So what she did, the teacher thoroughly researched on the symptoms of the children and found out that these were the symptom of visual impairment. So as a teacher, you should also know how to identify a child with a visual impairment in a classroom. So for which you need to also know what could be the indicators or a sign a child may show as a visually impaired. So let's just talk about it. Let's just identify the child who is visually impaired from the appearance of eye. If a child is having one eye turns in or out at any time, this could be the sign of visual impairment, which means a child is having an irregular movement of a pupil or the pupil is turning in and out. Then next one is reddened eyes or lids. If the child is having red eyes or eyelids, then this could be the sign. Then eyes tear excessively, as we had also discussed in the story that the child was excessively tearing, then this could be the sign. Then next one is encrusted eyelids, which could be the accumulation of dust or dirt over or under eyelashes. Next one is frequent styes on lids, which could be due to the infection, or this may be the cause of visual impairment. Next is complaints when using eyes at text. Generally, the students who are in a classroom or doing some kind of work with eye focus, they generally face headaches, burning or itching after reading or desk work, nausea or dizziness, print blurs after reading short period of time, which could be this could be the reasons behind the visual impairment. If the child faces this continuously, persistently throughout 4 to 5 days, then this could be the reason of visual impairment. And generally, the print blurs usually appears to the child who are visually impaired. Otherwise, all the students generally can read and write clearly. So behavioral signs of visual impairment, which is eye movement abilities, ocular motility, which means finding it difficult to track or detect object. So here in this particular video, the figure is from Tarak Mehta Ka Ulta Chashma, who turns his while reading from left to right. This could be a reason for visual impairment. Next one is says place while reading. The students loses place who had visual impairment loses its place, like where it he or she was, needs finger or marker to keep place. Generally, the primary class students do prefer to use marker or finger to keep place while reading. But if it happens in classes, then it should be a concern for a teacher to identify the reason. Display short attention span in reading. Obviously, if a child is visually impaired, the reading or copying would be of less span. Too frequently omits words, repeatedly omits small words. It refers to the words like it is on, which are two letters word. So or maybe three letters word. So generally it skips this kind of words or omits this kind of words. Means drawing poorly on page. Generally the students with visual impairment less eye-hand coordination, due to which it orients the shapes and size very weirdly. Like if they want to make a square, then they will end up making triangle. Then this could be the visual impairment. Now let's just talk about eye-teaming abilities. First one complains of seeing double, which is diplopia. If a child sees letters, number or phrases double, which means he is or she is having a kind of visual impairment. Then repeats letters within words, then omits numbers, letters or phrases, misaligns digit in number or column. Misaligned digit in number column, which means he or she may find it difficult to place a particular number in a row or a column, squints, closes or cover one eye. If he or she is reading or seeing something, then he or she may close, squints or covers its one eye, then it could be a sign of visual impairment. Now let's talk about the refractive status, which is related to the nearsightedness, farsightedness, and focus problem. Blinks excessively at desk, task, or reading. If your child blinks excessively during reading and writing, it could be the cause of visual impairment. Next, hold books too closely. If the child is hold books too closely while reading, then this could be the sign of visual impairment. Again, if the child complains discomfort in a task that demands visual interpretation, then this could be the sign of visual impairment. Makes errors in copying from chalkboard to paper, squints to see chalkboard or requests to move nearer. Obviously, if this kind of symptom, the last one, if request to move nearer to the blackboard, then this could be again the symptom of visual impairment. Now let's talk about the various assessment techniques for visually impaired child in the classroom, which means the range of specialized methods used to understand and support the educational needs of a child with visual impairment. These techniques go beyond standard academic testing and focus on how the child uses their vision to learn and navigate their environment. We are going to discuss about particularly these three techniques. Now let's just talk about the clinical low vision evaluation, which is generally done through this particular kind of chart or other methods, but normally through this chart. A clinical low vision evaluation is a specialized assessment for the individuals with low vision to determine if they can benefit from optical devices. Optical devices here, it means lenses or glasses. It assesses how the child uses their vision daily in school, home, and community. Visual acuity, visual field, and color vision are measured. Visual acuity, which means a particular unit of a visual impairment is measured. Then visual field is where the uh, visual defect is there in an eye of child. Then the next one is reflective errors and potential for vision devices are also checked. Now let's just talk about functional visual assessment. It is generally done by a teacher to a visually impaired child. This is assesses how the child uses their vision in everyday life, investigates how the child uses vision for near, intermediate, and distance tasks, like what kind of things, what kind of behaviors the child opt for for viewing the near, intermediate, or distance objects. The result help to determine the child needs for assessing visual information, like the details obtained from the particular assessment is used to assess the visual impairment of the child. The it is performed by the teacher and the student with visual impairment. Now let's talk about the learning media assessment. It is what to provide the support to the child that how it will learn or perform well in its academic tasks. So it is determines the best mode and format for the child to read and write. It may include braille, audio, digital text, large print, or combination of approaches for both visually impaired, uh, in which includes blind, totally blind, and low vision student. Then it helps to identify the accessible educational material to students the student needs, like what could be the teaching aids, or what could be the learning materials for the student could be used who are visually impaired. Also, the braille instructions are also determined through this particular learning media assessment technique. As you can see in the video, the child is imprinting the braille on a paper, and now he's trying to read this braille using his fingers. And this child has low vision, as you can clearly see from his lenses thickness. Also, the child is using the thumb pin to locate where he was reading last. This child is also using braille to read the page. Now let's just talk about the other possible assessment, which is other assessment may include orientation and mobility assessment and assistive technology assessment. Here we are talking about mobility assessment. So here I had in this video particularly, you can see the child is using cane to move from one place to another for effective navigation. And also these assessments help to determine to best support the child's unique needs. So here are the references. I had put it the links from where I had taken the content. First one from trinity.edu, second one from the Outreach Center for Deafness and Blindness. Third and fourth one are the links for the YouTube videos which I have used in my content. And the fifth one is the images are sourced from internet. I have compiled images from across the web to illustrate this topic. If any images are subject to copyright, please let me know and I will promptly address the issue. Thank you for watching and have a good day.